My name is Nathan Hodek. I'm the Deputy Insurance Commissioner for the state. I also serve as the chair of the Governor's Task Force on reducing prescription drug prices, and I will be moderating the discussion this morning. So as you all know, we're here today to discuss the really important topic of out-of-control prescription drug prices and the challenges that too many people face in accessing the medication that they need. We also want to take some time to talk about the governor's budget and the proposals that are included in his budget that would help people afford and access the medications that they need. As some of you, or as most of you are probably aware, there are many provisions in there, such as capping the copay for insulin at $50 per month, creating an insulin safety net program, creating a prescription drug affordability review board, allowing the importation of prescription drugs from Canada as a way to access lower cost drugs, and also strengthening the regulatory oversight of the entire prescription drug supply chain, from pharmacy benefit managers and insurers to pharmaceutical manufacturers and sales reps. So we really appreciate everyone's willingness to be here today to share your perspectives and your experiences. And we look forward to having a really good discussion over the next 40 minutes. So with that, I will turn it over to Karen Timberlake, the Interim Secretary for the Department of Health Services.
Great, thanks Nathan. Good morning, Governor, and good morning to all of you. I want to offer just a few brief comments as well by way of welcome and by way of opening. So we at the Department of Health Services have the job, as it says in our mission statement, of protecting and promoting the health and safety of all the people of the state. And as you can see by virtue of this discussion today, we can't do that alone. We of course do that in partnership with our colleagues at the Office of the Commissioner of Insurance and a number of other partners all across state government. One of the things that the governor has really tasked all of us with doing in state government is to connect the dots across all agencies for the benefit of the people of the state for whom we all work. And from our standpoint at DHS, what that means as it relates to the topic of prescription drug affordability is we need to be thinking about how we can make sure that absolutely everybody has access to affordable health insurance. In our lane, that means really supporting a strong Badger Care program and making sure we remove barriers to enrollment in Badger Care. It also means supporting the provider partners that we work with, so the hospitals and clinics and pharmacies and behavioral health providers and others who we know are part of that healthcare delivery safety net. And it means using the leverage that we have in state government to really promote affordability of healthcare, prescription drugs, and all across the board. And I think that'll really be an important focus of our conversation today. So we're delighted. I'm delighted to be a part of this dialogue. And with that, I'll turn it over to the man who has caused us all to gather here today, Governor Tony Evers.
Thanks a lot, Karen. And greetings, everybody. I'm really happy to be with you today. This should be an important and really interesting discussion. With, we all know that prescription drugs costs are rising rapidly and it affects Wisconsinites every day. So this topic and conversation that are happening today is really, really critical and timely. And as experts and advocates and stakeholders on this issue, I just want to thank you for taking your time today to be with us to share your insight and perspectives. We have to do more to make sure that healthcare is affordable and accessible for every person that lives in the state of Wisconsin. Picking up your medication shouldn't break the bank, but we know that for too many, whether they have coverage or not, high out-of-cost expenses are straining family budgets and forcing them to decide between buying medication and being able to afford basic needs like rent and groceries, heating your place. Folks are cutting pills in half, skipping doses, rationing their insulin, or just not filling prescriptions just because the cost of their medication is too high. And frankly, that's just wrong. That's why I established a task force on reducing prescription drug prices in 2019. And now we're building on that work within our state budget proposal with over 20 policy solutions to reduce the price of prescription drugs and ensure Wisconsinites can access and afford needed medications by controlling costs, really increasing transparency and oversight, strengthening consumer protections, and bolstering programs designed to support Wisconsin's most vulnerable. Some of these policies include creating a prescription drug importation program that would allow the state to import medications that would save money for consumers and taxpayers, and giving the state authority to study, develop, and pursue a state prescription drug purchasing entity, which would allow for more state and local collaboration to combine and leverage our purchasing power, which could help us reduce the cost of prescription drugs and save taxpayer dollars. I'm also proposing creating an office for prescription drug affordability, which would provide oversight over the pharmaceutical supply chain. And for me personally, learning how that supply chain worked, and it was a real eye opener. So this is a really important one. So finding some way to have oversight over that, protecting consumers, as well as the Prescription Drug Affordability Review Board, which would establish prescription drug spending targets for public sector entities and establishing price limits. And finally, I'm proposing creating an insulin safety net program to ensure that insulin is affordable for all Wisconsinites. So these both policies will help us reduce the cost of prescription drugs and expand access to medications for all Wisconsinites. Now, folks, it's time to get this done. And I want to thank you not only for your advocacy here today, but every day. And so I look forward to hearing and learning from all of you during our conversation this morning, and continuing our work together to make sure our state bounces back stronger, better, and healthier than ever before. So thanks for being here again. And it's exciting times. We can get a lot accomplished if we work together. And I'll toss things over to Nathan, back to Nathan, who is the Deputy Commissioner over at the Office of Commissioner of Insurance and the Chair of the Task Force on Reducing Prescription Drug Prices. Nathan, it's all yours. Take it away.
All right, thanks, Governor. I really appreciate it. I just want to reinforce that, the governor's really been a leader on this issue. I know it was something he talked about, when he was running for office back in 2018, there were a number of provisions in his previous budget to tackle prescription drug prices. And coming out of the work of the task force last year, the set of policy recommendations and the items that are in the governor's budget to really get our arms around and tackle this issue is historic in terms of what we've seen in this state before. This really, it takes a really comprehensive approach to address transparency issues, pricing issues from many, many different perspectives. So it's really historic in nature, just how big and comprehensive the initiatives around prescription drug price efforts are included in the governor's budget. So with that, we really want to open it up. As I mentioned, we want to have a good discussion today. We really want to hear from all of you. So I think, what we'll do is take some time, kind of go around the horn here. If everyone could introduce yourselves and, say a little bit about why you're here and why this issue is important to you. I'll go, I know everyone probably has a different order in terms of how people are aligned on their screen. So I'll just go down the order that I have on my sheet here. So Jill, if it's okay, we'll start with you.
Sure. Thanks for having me. I have been a nurse for 26 years in Wisconsin. I was born, raised, and educated in Wisconsin, and now I'm raising my family here and doing what I would say is a hobby. I love taking care of and advocating for people with diabetes so much that I don't really feel like it's work. But now I'm working on starting a nonprofit community health clinic for people with diabetes. So every chance I get, I like to advocate for people with diabetes because it's such a significant cost and significant impact for people that we know and love. So thanks for having me.
Thanks for being here. Appreciate that. Jessica?
Hey, I have to ask, can you hear me okay? Okay, so I'm Jessica Smith and I'm an elder benefits specialist at the Aging and Disability Resource Center of Eau Claire County. So I help mainly people age 60 and older but I'm also the chair of the Wisconsin Association of Benefits Specialists Legislative Committee. And our members serve people with disabilities age 18 to 59 and older adults age 60 and older all across Wisconsin. So we run into drug issues all the time. One of our job duties is to troubleshoot drug issues with people and to help them to connect to resources. So we definitely have a lot of experience with that. So thank you for having us in this meeting. And then also I do have a client who was supposed to join, but she's having some health issues today. I'm not sure if she'll be able to, Patricia. So I just wanted to introduce her to just a little bit about her. She's on disability, 63 years old. So her spouse's employer coverage is actually primary. And then she also has a Part D, and she has to take many brand name prescription drugs, and that causes many problems. So I may talk more about her story later too. So yep, we definitely have a lot of things to talk about, and we really appreciate that there was a task force created and that some solutions are coming to fruition. So thank you.
Great. Thanks, Jessica. And thanks for everything you do. And I do want to note that Patricia did submit a letter kind of outlining her story and all the struggles that she's been facing to the task force. And that is included in the final report that was published last fall. So we appreciate her sharing that story. Nancy, we'll turn it over to you.
Hi, my name is Nancy, and I live in West Allis, Wisconsin. I am a retired psychiatric nurse. I don't do anything fancy like you other guys. I am an AARP advocate, and so this is one of our primary goals for the new budget, is to get prescription pricing under control. So thanks for doing this. I'm glad to be part of it.
Thanks, Nancy. Appreciate it. And I would say being an AARP advocate is pretty important. So thank you for that. Ben, we'll go to you next.
Hi, my name is Ben Wilson. I'm in the heart of the Driftless region in Viroqua, Wisconsin. Professionally, I am an activist and a community organizer. One of the main things that I work on is expansion of healthcare, access to healthcare across the state and the nation. Personally, I was diagnosed with HIV 15 years ago. My medication that I currently take retails for about $3,000 a month, while it costs about $1 a month to manufacture. So, I have a strong vested interest in drug affordability, because this kind of toxic capitalism cannot be allowed to exist. It just can't. People are literally dying. If I went a few weeks without my medication, I would go from an undetectable viral load of HIV to being in the danger zone of moving on to the next phase beyond HIV infection. So I'm more than happy to tell my story a little bit later. Thank you very much.
Thanks, Ben. Appreciate that. Zena, we'll go to you next.
Thank you for getting my name right. My name is Zena. I live in Southeast Wisconsin in Twin Lakes. I am here as a consumer, as a healthcare patient, and a member of Wisconsin Southeast Co-op and the Healthcare Board. I also have very expensive monthly medications, which is one reason I'm heavily invested in what Governor Evers is doing. One medication in the last 3 months has risen in price $426, and it's now over $6,000 a month. So without my husband's insurance, I would not be able to even function on a daily basis. So thank you for having me, and I look forward to our discussion.
Thank you. Appreciate it. And Thomas, we'll go to you.
Hi, my name's Tom Slayton. I'm 62 years old. I live in Edgerton, Wisconsin. And I'd like to say that I'm here to advocate for clinics like HealthNet of Rock County, to get more funding for them to help them better serve the community. and to help out with all the medications that people are, dying that they need, that they cannot afford. And without HealthNet, I don't think I'd be here talking to you guys here today. So with that, I'm going to move to go ahead and go back to you. Thank you very much. And it's a pleasure to be here.
Great. Thank you, Tom. Appreciate that. And I know the governor's budget does include an additional $4 million investment in the free and charitable clinic. So hopefully that'll help HealthNet and others. And if I could just remind everyone to please keep yourself muted when you're not talking. There is some background noise. So we just want to make sure we're reducing that as much as possible. So now we'd like to just open it up and have an open discussion. I know some of you mentioned, wanting to share more about your personal stories. Also love to hear if anyone, has any perspectives or insights on the items included in the governor's budget and how that would have an impact on your situation or your loved ones. So happy to call on anyone, but I guess I'll just open it up first and just see if someone would like to volunteer to say a few more words.
Well, I'd actually like to go ahead and start out because I am a diabetic patient and I use 3 types of insulin every month. Total cost for that insulin, I'm guessing, don't have exact numbers in front of me, but would reach $1,200 a month or more. And I am all for this $50 copay because there's so many months where I did not get insulin because I just could not afford it. I'm on a fixed income being retired, and it just didn't fit into my budget at the time. And so I wanted to say that, I think 2015, Governor Scott Walker went ahead and put a knife in our back when he turned down the federal money to help people of Wisconsin with the Badger Care program. And I look forward to doing anything possible to help our new governor, Mr. Evers, to achieve all the goals he's set out for.
Thanks, Tom. Appreciate you sharing that.
Jill, I'll go ahead.
Go ahead.
So even though I personally haven't had to deal with the cost of medications, now my husband is now retired, so we're going to have to start changing, and the insurance is under mine. So this obviously may be an issue coming up, but for the most part, for so many patients in my community and patients that I take care of as a case manager of complicated patients, a lot of times they have a lot of medical conditions. So it's not just insulin, but a lot of things that are affecting their health. And what I've learned over the last years as a nurse is that some of the new medications that are studied and coming out they're more expensive, but they're also way more effective, not just for diabetes, but for all of these other conditions that are affecting Wisconsinites. So even though the insulin is old, I think it just had its 80th birthday. But even the new medications that are costly, but maybe so much more effective at reducing complications and reducing medical costs, and most importantly, improving the quality of life for people in Wisconsin. So that's why we have to act now to be able to get the best medications for the people of Wisconsin at a price that they can afford to continue to live and be able to pay their bills and contribute to society.
No, absolutely. And Jill, I saw you earlier when the governor was mentioning the insulin safety net program, you're shaking your head. Did you have any thoughts or anything you wanted to share about that? I believe that program is modeled similar to what Minnesota is moving forward with. So I'm not sure if it's something you've looked into.
Sure. I probably need a little bit more details when I like to look into that a little bit more, but I do know that Wisconsin would be the 16th state, not including Washington, D.C. As of yesterday, I think it was Kentucky that just their governor signed insulin copay caps. So Wisconsin could jump on the bandwagon and be, one of the first, obviously not the first, but out of all the 50 states, now 15 states in the Washington, D.C. have approved a copay cap of some sort. So I'm actually really interested about reading more about the insulin safety net. I know that as my experience as a advocate and a camp nurse, I've heard stories of kids 9 to 12 years old having to experience when they're diagnosed how in the world our kids should not be worrying about how their families are going to pay for insulin. These kids should be kids. And the fact that they have to think about those things and feel guilty about those things, it's just not acceptable. So I'm thrilled to hear of this program and where it could go and really what I can do to help make that happen.
Thanks, Jill.
If you don't mind, I'll just break in a little bit too. And I think the transparency and reporting across the drug supply chain is really important. The review board, all of that stuff is so important. In Patricia's situation, for instance, she does have Medicare, which some of the Part D do have insulin caps, so that's helpful if you're on Medicare, but I know that many people are not. But anyway, with her situation beyond insulin, she has some medications that are on tiers where you just have a percentage. So it's impossible to estimate what her cost is going to be until she actually goes to different pharmacies to find out. And like it's crazy. And also when her doctor is trying to get these prior authorizations, they're having to jump through so many hoops that one of her doctors actually quit. Like he wouldn't see her anymore. She had to find a different doctor because he was so tired of having to do so many prior authorizations and jump through so many hoops. And so anyway, I think the transparency is really important. I think all of these ideas are great. The affordability review board, all of that. Like I felt like the drug task force really started just uncovering a sort of almost like a secret world. We don't understand how things work, and there needs to be a lot more transparency. And the other things that we see as advocates around the state are high prices of inhalers, lots of hoops to jump through. There are pharmaceutical assistance programs, but those are targeted at people about 300 to 400% of federal poverty. So we see people fall through the cracks of those, and senior care. It's as great as senior care is. Obviously, there's still people that fall through the cracks of that and extra help and other programs like that. And then we see a lot of Part B prescription injections where most Medicare beneficiaries still have to pay 20% of that cost, and there's no help for that. So anyway, there's many different issues. The donut hole or coverage gap still exists, even though it's technically gone. You still have to pay 25% when you're in the donut hole, and that can be really unaffordable for people. As you know, our average income for people on Social Security is not that high, and many people fall through the cracks. So I think all of these ideas are really great, and we'll definitely support all of anything we can do to help push this through as well. We're definitely on board.
Thanks. Go ahead, Ben.
Rolling off
Thanks,
what-
Jessica. Appreciate that.
Oh, sorry. Rolling off what Jessica said about the prior authorizations, that's something that I deal with on a monthly basis. As I mentioned, my medication retails for about $3,000 a month. My insurance will cover it, but leave me with a $250 copay, which is something that I can't afford every month. That's a car payment. That's utilities. That's a lot. That's 2.5, 3 weeks of food. I can't afford $250 a month. If I get the name brand medication for my HIV, then I can get a copay card from the manufacturer. But every single month, my insurer denies me the name brand and switches me to the generic, which means that I don't have any manufacturer support. So every month, the pharmacy calls me and says, your prescription's ready to pick up. Great, mail it to me. Okay, let's take care of this $250 copay. No. It can't be the generic. You need to go back and get the pre-authorization. Because of this, I'm going to miss a dose of my medication. Every month, the prior authorization process takes a couple days, and I end up missing a couple doses of my medication. As I mentioned earlier, it doesn't take long for my body to build the virus back up. If I missed a week, I would no longer have an undetectable HIV viral load. And every time that I have to go through this process of telling my insurance company, no, give me the real one, is another chance for the virus to retake hold in my system. And it puts me in danger. And then on top of that, come November, I'm going to run out of funds with my Gilead copay coupon card, which means November and December, the worst months financially for everybody, I will have to pay the $250 copay those months. There's no ifs, ands, or buts about it. Those months I will have to pay. No matter if I go generic or real, I will have to pay that $250 a month, which means Christmas becomes a credit card expense, which just rolls into the financial problem, and it creates rolling financial problems. So any kind of assistance, a copay cap, anything. When I was on Badger Care, I went through a period of time of about 6 months where I was unemployed, and I was eligible for Badger Care. Badger Care covered my prescription fully, but I want to work. I want the self-satisfaction of knowing that I'm making my community a better place. I want to provide for myself. But I would be better off paying for my prescriptions. It would be easier to pay for my prescriptions if I didn't work. And that doesn't feel right to me. So yeah, that's why the pre-exist, and it is, I know that not every situation has an ultimate villain, but in this situation, I do view the insurance companies and the manufacturers as villains. My prescription, like I said, retail costs $3,000 in America. Australia, it's around $20 a month. India, $4 a month. I'm not sure about Canada, but this is insane. We can't rely on capitalism to provide us with things that we absolutely need to live. And I'm not saying that as a socialist or a communist. I'm saying some parts of our economic system are not viable for what they are intended to do. Capitalism and life-saving medication are at odds with each other. So that's all. Thank you very much.
Yeah, and I just want to jump in there for a second, Ben. And I have lots of frustrations around this topic, but the one that troubles me the most is what you're just talking about. Most recently, there was an article in the paper about expanding Medicaid or expanding Badger Care, and the speaker said that, first of all, that doing that is welfare, and second of all, it produces dependency by people on federal money instead of, just what you're saying. It produces this dependency, and then people won't get off welfare from, it's all about some sort of cabal that we have to keep people from working and all that kind of crap. And frankly, that just drives me nuts. I mean, basically, what we're trying to do, I think all of us, is keep people healthy, keep them alive. And if that's dependency, so be it. At some point in time, the state has to step in, and this is one of them. So thanks for putting that in human terms. I appreciate it.
And if we're in a society that won't guarantee things like a $15 minimum wage, a living wage, and we won't and we're worried that welfare is creating dependency, then there is no path for millions of Americans. There just isn't. We won't provide you the money you need to survive on your own, but we won't provide you with the support you need to survive on your own. You're just, it's a caste system almost. But thank you very much, Governor.
Yeah, I like to say that it's kind of an attitude problem because or a false pride, I guess, because I talk to people all the time who have been hard workers all their life, and now they're having to take this medication, and they hesitate to even use these assistance programs. And I tell them, you worked hard all your life. That's what these programs are for. We want to provide for you. It's interdependence in our society, not just independence. You know, we're all Americans and try to be so independent, but we actually are interdependent, and we need to have a little bit of human and an attitude check, I think, in our politics, and know that government should be here to help our society and help the people who are hard workers. You know, that's just my opinion, but yeah, thank you.
I'd like to go off of what Ben was talking about. I understand the very expensive every month. I do not have a generic option available to me. I don't know why my medication, just one medication, has increased $426 in 2 months. I'm actually on about 4 medications that I must have. And the scary part for me is my condition was caused by a norovirus. So the fact that we have a coronavirus, I'm very concerned what this is going to do to people long term, because I'm kind of experiencing that 4 years before them. I have issues with inflammation throughout my body. I've experienced neuropathy. I've had damage and white spots in my brain from the inflammation in my blood, which is very similar to what some of the COVID patients are going through. So the fact that my medication keeps going up without any reason why during a pandemic scares me for people who are just starting this journey, and what they're going to go through. And the fact that we don't expand Badger Care. I had Badger Care for 1 month when I got sick and couldn't work, and my husband lost his job, and there went the insurance. And we made $25 too much on unemployment to get Badger Care. So we had to decide, do we pay the mortgage or do we buy my medications that keep me from stroking out? And that's not okay in the greatest country in the world. That is not how we should treat people. It's not right. I'm a hard worker. I'm educated, college educated, and the fact that I couldn't get assistance when I needed it after paying in for so many years was very frustrating for me. And that's why I support Governor Evers and all that he's doing. I feel that he's taking the right steps, and I will do anything I can to help make that happen. And so thank you, Governor Evers, for all that you're doing.
I can talk after Zena. I have rheumatoid arthritis, which doesn't get better. It's a progressive disease. And after 30 or 40 years, I don't know how long I've had it, forever, we have finally found a medication combination that works. Well, the one medication, I don't know how much it is. It's like $3,000 or $4,000 a month. Fortunately, they have a patient assistance program, which I participate in, so I don't have to pay anything, which is a miracle. It's a weekly injectable, and there's no way I could afford it. The other med, which was the newer addition, was free through my insurance company. So I would get 3 months worth of this medication and be set. And this combination probably is the only thing that works at all. Well, the insurance company decided to move the tier of the second medication, the non-injectable, to some horrendous level. So now I can't afford it. I can use GoodRx and get a little cheaper, but even then it's still quite pricey. I mean, I've done it because I don't know what else to do. Anyway, I have countless examples of this. My husband has COPD, and his inhalers that he needs in order to breathe are horrendously expensive, and it's as low as it'll go. He can't get it any cheaper. So it, it's kind of a vicious circle. And I would be so happy if we could get some kind of cap on prescription prices. And Governor, I totally support you. I really hope that this gets passed because we need it. And I used to be on Medicaid and I no longer qualify because I make like $3 too much or some such. Anyway, it's a problem. It's a major, major problem for many people, including myself.
If you don't mind, I would like to follow up. You know, when I mentioned in my introduction that insulin was about 80, it's about 80 years old. And a couple of years ago, I was meeting with somebody, a representative at the federal level to talk about diabetes. And it was right actually the day of the anniversary that insulin was invented, or, you know, and at that time, when kids were diagnosed with type 1 diabetes, they basically were just expected to die before insulin because they did not have the answer for it, the treatment for it. They were basically it was a death sentence. And the way I see it, 80 years later, where are we as a society if people can't get that insulin and they have to ration it and can therefore die because it's needed for life? And I want to make Wisconsin better and not where we were 80 years ago before insulin was invented, because people shouldn't have to choose between life and medication. So let's get this budget passed so that we can be better than we were 80 years ago before insulin was ever invented. And I've been able to meet a lot of people volunteering for diabetes camp. I didn't have any experience with type 1, and now I help out with camp. And we have young kids that went to camp with type 1 diabetes when they were 9, 11 through 16, and they are now going into the healthcare fields because of those experiences. And they are going to college, getting good jobs, and being able to pay that forward to other people. They're going into fields where they're making a difference. And even these people have had to go and, you know, make choices when it comes to insulin costs. And we need to be better than that. And this is the way to do that.
Well, thanks, Jill, and I'd love to keep the discussion going, but we are running up on our time here. So I just want to thank all of you. Before I turn it back to the governor, I do want to just say, I know, you know, almost everyone has mentioned how supportive you are of the provisions in the governor's budget. And, you know, we all know there's a long process with this budget. It has to go through the Joint Finance Committee. It has to be approved by the two houses of the legislature. So it's really important that all of you and other people who support what the governor has in his budget continue to be engaged throughout this whole process. Contact your legislators, tell your friends and neighbors to contact your legislators. You know, we really need to reinforce with the legislature that these items are really important. And these things, when the final budget is done and signed, we need to make sure that these items that the governor has put in the budget stay there and are signed into law. And we need help from all of you and, you know, thousands of other people across the country to continue to, you know, deliver that message and continue to be the squeaky wheel with the legislature. So I will stop there, and Governor, I'll turn it back to you.
Well, thanks, everybody. What a great group you are, and great stories and sad stories. What frankly drives me nuts around this topic, and I come from a healthcare family. My father was a physician. He actually ran a tuberculosis sanatorium years and years ago. And my daughter's an OB obstetrician, and last time I checked with her, she's in her mid 40s. She's already delivered over 8,000 babies in her lifetime. That's bigger than the town that I grew up in. But what drives me nuts is this, and I'm a Democrat. This has nothing to do with being a Democrat. This is about doing the right thing. I have kind of an ongoing text relationship with the governor from North Carolina, who's a Democrat. He has a Republican legislature. And both of us are in the same predicament. I'm sure he could find people just like you that are struggling, or that work with people that are struggling around issues of medicine, and making sure that drug prices are reasonable. But the entire healthcare situation, where we are choosing or making choices that frankly aren't good choices for people. And so I actually got a text from him last night with the new Recovery Act. They incentivized even more so than they have in the past to get states to expand Medicaid, expand Badger Care. And he's having some of the same problems I'm having. And he said that it looks pretty good in Wyoming and Alabama. Now, Alabama and Wyoming are, red states, and so they've decided that this isn't a Republican or Democrat thing. I'm sure the Democrats in Wyoming and Alabama are all for this. So it is nothing more, folks, than in our state, in North Carolina, he's having the same thing here, where people just decide that this is where one side is going to be, and this is where another side is going to be, which is absolutely not why I got elected. I believe I was elected not because I was necessarily the Democrat with the right ideas, but that there are such things that I like to call Wisconsin values that are kind of basic. And one of the basic ones is around having affordable, accessible health care so that people aren't struggling like you all are. So, and I apologize for being so frustrated with you, but I do, this is going to be a fight, and we have to win this fight. It shouldn't have to be a fight, because this is not a Democrat or Republican issue. It is around the value of making sure that people have access to quality and affordable health care and accessible health care. So I know you're with me, and whatever you can do around this issue of making sure that we expand Medicaid, and that we really take a good, healthy swipe at making sure that drug prices are within reason and affordable. We can do this. As somebody just mentioned, I don't know if it's Jill or somebody else, that Kentucky, red state, Democratic governor, Kentucky just put a limit on prices for insulin. So we can do it. It's just a matter of kind of getting over this hump that somehow this is a Democrat or a Republican issue, because it flat out is not. So thanks so much, folks, and thanks for being here today, and thanks for sharing your stories and having this interaction today.
Thank you, Governor.
Thank you very much, Governor.
Thank you.
Thank you.
Let's get this done.